I noticed that when I take medications a lot, well, I have to take I have to keep taking medications for my headaches when I get them.
Okay, don't do that.
No?
Medications can cause your headaches to get even worse. Right, Neil?
Sometimes.
Sometimes? Like when?
When you take too much medication.
When you take too much medication?
Mm-hmm.
So like, if I just take medication once in a while, it wouldn't hurt me. But if I took medication around the clock.
Only take medication when you're like sick.
Yeah.
When you need.
If I keep taking acetaminophen or I could keep taking ibuprofen around the clock or like those pills that have caffeine in them that help with headaches,
Then you get another headache, called a rebound headache.
I would get another headache called a rebound headache? Oh, okay. Okay. I want to ask you one more thing. What about, like, my mom keeps getting on my case because she says I'm always on my phone and then that's making my headaches worse. Is that true?
Yeah,
That,
probably.
like, too much screen time is bad for
Yeah.
my...
Yes.
Yeah.
Your brain
How much
melts
time?
and it ooze out of ear.
Oh, gosh, that sounds really bad.
how
I don't think that happens, though.
Yeah,
how
that
much time do you
happened.
spend on screens every day, including in school?
Oh, let's see. So in school, we're on the screen, like, maybe 2 or 3 hours a day.
And what are you doing on the screen in school?
So I have to do coding classes, and
Okay.
we have to.
Oh, so it's
watch
like
videos.
learning stuff.
Yeah,
And
and
then-
then I come home and I just want to like have fun. So then I watch TikTok videos.
Oh, okay.
And,
For how long?
I don't know, like as long as I can.
But like, how long is it usually? We need to have a time number. We need numbers
Oh,
to
numbers.
calculate your formula.
Maybe like 4 hours a day.
That's how much I do in a week.
That's how much you get in a week. Oh, so
No, on a weekend,
mhm.
and we don't get any during the week.
Oh, okay. Wow, you're in medical school and you get limitations on your screen time?
We're actually only 10.
Oh, okay.
We're twins.
You are. You don't look anything alike.
Who said twins had to be identical?
Yeah.
So,
Yeah. We twin because we opposite.
oh, okay. So opposites are twins. Cool. Okay, so it sounds like there are a lot of things that can trigger the headache. So these are some things. You guys did a really good job. So these are some of the things we talk about. Food and timing of food and the types of foods, water and hydration, enough sleep. Thank you for demonstrating that. Stress relief, hormones, and medications that can trigger it, screen time that can trigger it. So there's a lot of things that can trigger headaches. Okay? So now I want to play a little game with you. Okay, so the different types of headaches we're going to talk about. I'm going to give you a little bit of a description of a headache, okay? And then one of you raises your hand and then you get to answer what kind of headache it is.
Okay, and whoever raises their hand first gets to answer, and if that person gets it wrong, then the other person goes?
Yes. Okay?
Okay. I know those games, like those mathathon things, like where people hit a buzzer, but if we hit this, it's going to make too much sound. So just raise hand.
Yeah.
Okay.
This is this.
Okay. Nope. Just
No,
raise your
just
hand.
raise your hand.
Just raise your hand. Okay? All right. So this is a headache where when you get sick and you're really congested, you feel pressure that comes from the inside of these cavities in the skull that, hang on, I'm going to keep saying it first, but I know you. So that you feel them usually on your forehead, on your cheeks, between your eyes, and behind your eyes. So can you tell me what kind of headache that is?
A pressure ache?
I forgot the name.
Okay, so there are these cavities in the skull, and they're called sinuses. And
Sinus headache.
Yeah. Okay. So you're right. So sinus headache. So that's a really
You
common
didn't raise
reason.
your hand, Maya?
And sinus headaches. One of the signs of a sinus headache is that you feel that pressure. You've kind of had a recent cold, and a lot of times your breath smells really, really bad.
Oh.
Yeah. What are you trying to prove there?
That he has a sinus headache?
Yeah. Okay. So that's a sign. And then if you push right here or here or here, you feel pressure. It actually is painful. So that's a sign of a sinus
Next
headache.
headache.
Okay.
Next headache.
Next headache. Okay. So this is a headache that feels like a band around your head, and it feels like really tight, and it's triggered by stress or bad posture or lack of sleep.
I raised my hand before you, Maya.
Yeah.
I know Neil goes first.
Okay, Neil, go
Tension
ahead.
headache.
Tension headache.
I was
good.
gonna say that.
Good. So, some things we can do is have really good posture, right? All right, next headache. All right, so this is a headache where people describe it as the
Wait. I'm sorry. The second you started talking, Neil just raised his hand.
Okay, put your hand down.
Okay, fine then. If you raise your hand, you have to say it.
You have to say it.
Okay, so what's your
go
name?
ahead,
No,
what's your-
right now.
Okay, so let's go.
Okay.
The second somebody raises their hand, they have to say it, even if you're not finished talking, okay?
Yeah, if you're interrupting me.
So if you raise your hand while mom's still talking, you can do that. If you can, but then mom's gonna stop talking to ask you.
Okay.
Okay?
All right. So this is like the worst headache of my life. It just came out of nowhere. Oh,
I had the first.
you had it first, but can I finish it?
No.
No.
Thunderclap.
Thunderclap
I
headache.
was gonna say that.
Okay, so that kind of headache is an emergency. So if it comes out of nowhere and it usually gets worse really quickly, we call it thunderclap for a reason. It could be a sign of something really, really
Because
bad.
it happens within seconds. It would just like a thunderclap comes out of nowhere.
Yeah. Yeah. So exactly. So that's like get to the emergency room as fast as possible.
Okay.
The closest emergency room. Okay.
Okay.
All right. Okay. So now this is a headache that usually happens on one side of the head, and oh my gosh. Okay. All right. Maya got this one.
No.
Yeah.
Migraine.
Migraine. So it starts on one side of the head, and it usually feels like a throbbing pain. Okay. And usually bright lights and loud noises make it worse. And those lifestyle things that we talked about earlier, those are the things that can help prevent them and make them better. Okay?
Okay.
All right. Let's see. What have I? Oh, okay. How about this? This is a headache that after I already had headaches,
Rebound headache.
oh my God.
I'm correct. Rebound headache.
Okay, so rebound headache. So do you know what a rebound headache is? Do you want to tell me
When you
about
take
it?
a medicine for the headache and it has caffeine, you get another headache.
So it doesn't have to have caffeine. Often the ones that have caffeine can make it worse. Sorry. Medicines like acetaminophen or ibuprofen can trigger more
Okay.
headaches.
Are there
Okay.
any more headaches? Any more questions?
Yes, there is. There's one more kind of headache, okay? It's really common. It's more common in males. So these headaches usually come at the same time of day every day, and they tend to come in clusters together.
Plus headache.
And
Hey, you didn't raise your hand. Wait, wasn't there one that starts with man or men?
Medicine.
medicine?
No,
I
a
think you're
headache.
talking about meningitis.
Yeah, meningitis.
Okay.
Do men get meningitis?
Well, men and women can get meningitis.
Oh, I thought it was
Yeah.
men because it's called men.
That just means itis means inflammation, and it's itis of the meninges, which is the layer around the brain. Okay?
Oh,
Yeah. Okay. So actually, you know what? That's a really good point. Maybe we should start talking about when are headaches serious. So we talked about most of the times when people come in for headaches, most of the times they're not really serious headaches. But sometimes, and that's when most people come in to see the doctor, they want to know, like, why am I having this headache? Is it something serious? That's always the question.
Okay, so what are
Even
some
if people don't ask.
what are some serious things that could cause headaches?
So, well, the big question that a lot of parents have is like, or not just parents, but anybody, if they're coming in, is this a brain tumor? So that's kind of the really scary thing that people will say, is this a sign of a brain tumor?
I know somebody who has a horrible headache.
Mm-hmm.
James Cage.
No, Phineas Cage.
Phineas Cage.
Phineas Cage. Oh, my gosh.
Gage.
Phineas Gage. Yeah.
Gage.
Phineas Gage. So,
Phineas is in the cage.
no.
It's Gage.
A bar of the cage came off and it hit him in the head.
Okay. So his name is Phineas Gage. He was a railroad worker way, way, way a long time ago before any of us was alive. And this, yes, very serious headache because there was a bar that came off and it flew into the front of his head and it caused,
Did it come out the other end?
I think it went through, but it caused a lot of damage to the frontal part. And
Obviously.
he was a really, he was said to have a really wonderful, nice personality. He was really friendly and kind. And then afterwards, his personality completely changed. That's kind of how they found out what that part of the brain does, or one of the functions of that part of the brain, because he lost that function. But man, imagine that headache. So yeah,
Okay, I have a question though.
yeah.
Was it was it a rod like this thing that has like stuff inside it, or was it like open inside? Because if it went in like that, then it would have scooped out the insides.
I do not know the details of the rod
Because
itself.
then it would have scooped out the insides of his brain.
Ew. Okay, I don't want to talk about that anymore. Okay, so yeah, but most of the times people worry, and that's when they're coming to the doctor because these headaches are continuing, they're not getting better, and there are some red flags. So let's talk about some of those red flags. So when patients come in, concerns that they have that, make me worry that this might be something more serious than just kind of like a regular headache that can be treated with lifestyle, but something that's more serious. Okay?
Okay.
So like, for example, if I see a kid that's 3 years old as opposed to an older child that's like 15 or 16 years old who's already had headaches. Okay?
Okay.
So that's one thing. Okay?
Why is it bad if a baby has a headache?
It's just a sign that something more serious. The younger you are, the more of a sign that something could be more serious.
Okay, but doesn't like everybody get headaches at some point? Like, what's the problem that a baby has one?
They can, but if a baby has a headache, it's just a sign, or like a younger child has a headache, it can be a sign that there's something more serious going on, like a brain tumor when
Or
parents
like
are
a
concerned,
bleed in the brain?
or a bleed or something like that.
Okay.
That we have to worry about more. Okay? Okay. Now, also, if somebody older, like someone who's 40 or 50 years old, who's never had a headache before, if something about the headache changes, like, for example, if, the frequency changes or the severity changes or the location changes, that could be a sign of something more serious.
Okay.
Okay? If there's a headache after a head injury, often, we, depending on what's going on, we kind of grade it. There's like a scale that we use to see how serious that could be, that this could possibly result in a bleed inside the brain. All right?
Okay.
And we worry about a bleed inside the brain as opposed to like a bleed like that was on your skin, because a bleed inside the brain, like it causes more pressure in the brain, right? Or on the brain.
So then your brain can explode?
It won't explode, but that pressure can be really bad. That pressure can cause damage.
Okay.
Okay. So, okay.
Okay.
So like sometimes you guys have fallen, and I have, I've woken you up at night, right? Because I'm looking for different signs, like signs of like you're not talking normally, you're not acting normally, you have weakness, you have numbness, different things could happen that could be a sign of something more serious. Okay. So usually we say within the first 24 hours after a head injury to really observe that there's somebody there who's observing the person who got hurt.
Okay.
Yeah. So do you have any other questions, Neil? No? So you know everything about headaches now, right?
Yes.
Yes. So now Dr. Reiki and Dr. Reiki, you got it covered?
Yeah.
Most important takeaways is that we can prevent our headaches with just the way that we live and making sure we're eating well, keeping ourselves hydrated, sleeping well, and reducing stress. Okay? All right, Neil, do you want to close this out?
Bye, everyone. I hope you all learned how you can prevent a headache. Subscribe and like our channel below.
Thank
And remember
you.
to watch till the end and leave a comment.
Watch to the end and leave a comment and subscribe. Thank you so much for watching.
But this already is.